Thank you for taking my question. This question is directed towards Senator Dodd and Congressman Murphy. It's coming from the WCSU College Republicans. I appreciate the question. Undocumented immigrants.
Equal opportunity.
Okay. Undocumented immigrants, especially in cities such as Danbury and New Haven, in the state of Connecticut, create huge strains on hospitals and the medical system. What will your proposals do to counteract this massive problem?
Well, and Chris and Mike as well, we just did the S-CHIP program. This is one involving kids. And there was a debate in the Senate, and a particular amendment directly to your question. And that is, should we take children here who are legally here, not citizens yet, but legally here, do we cover them as part of the S-CHIP program to give children health care? I supported that. I supported giving legal children highly contentious issue, particularly during times of tremendous economic stress. People's feelings about undocumented workers in our country run strong, and I recognize that. But I also happen to feel, number one, first, if the child is here legally, and again, a lot of these children come as infants in many ways, so they make the decision themselves to here. Secondly, having a child who is not getting proper care showing up in a school system. I have a bit of a cold and a cough right now. I've got a 3-year-old and a 7-year-old. I'm living in a petri dish. Because every day they come back, obviously, and they're sniffling and sneezing and coughing and wheezing. And so, in a sense, having children who are not immunized, not getting proper care, showing up in a school system where community contaminates potentially others as well. So we've got to get beyond the issue, in a sense, of whether or not they're citizens or not here. The issue has not come up on the question whether or not people here undocumented. And obviously, we've got millions in the country who here's undocumented issues. A little less and less, but nonetheless still an issue. I'm sorry, one second.
What about the adults? Not so much children. What about
the adults? Are not covered in that. And you can get a debate back and forth. And obviously, it raises the same kind of health issues in a sense. Obviously, if someone's going around with some infectious or contagious disease who's living next door to you here in Danbury, I presume, I don't know what your answer would be, as a citizen of the community, whether or not you want that person to get some health care coverage or lead further exposure, in a sense. And people can make different choices on that matter. If you're talking the abstract, the answer is fairly easy. You don't think they're going to get it. If you live next door to that person, you may have a different response to the question. But my own view is the question was whether or not it was legal. The adults was different. Yeah. No, Chris, do you want to comment on that?
No, I would just say that we got to remember whether we're talking about undocumented immigrants coming and receiving services at the hospital, or we're talking about citizens of this country coming and receiving services who don't have insurance. All of those people, regardless of their status, are being paid for somehow in this system. That all those folks showing up at the emergency room are being paid for by everyone else in this room that is either paying taxes or is paying private insurance. I think it is a very important question that you're asking, and I think it's central to why a lot of us want to proceed forward with the parallel issue of immigration reform. But I think it's just important to remember that all of those people that we sometimes castigate for not having insurance, they're being paid for by the society as a whole, and it's part of how we lower the overall cost is by getting those people hooked up with insurance.
That's a great point, Chris. I mentioned this about a year ago that our 3-year-old got a very bad infection of throat at night. We raced down to the clinic. The guy he was confident to do it, so he sent us down to Yale and Haven. We got there at 11 o'clock at night. By the time they saw Christine, it was about 4 in the morning. And it was an eye-opener to be in an emergency room between 11 at night and 4 in the morning, 4 or 5 in the morning. Now, there were people who came in who had automobile accidents, and others who had problems. The bulk of the people who came into that emergency room were coming to see their primary care physician. They waited so long that they ended up having temperatures that were 102 or 3, matters that probably could have been dealt with otherwise. It's the most expensive form of health care in the United States, is an emergency room. And so we started asking these questions back and forth. Are we better off, in a sense, having people show up at the most expensive health care, going back to the prevention issue, obviously. So, there's not black and white, these issues. They're complicated questions of how we grapple with these. And obviously, as I said a little while ago, the issue of how we deal with immigration policy is obviously a highly contentious one. And not just because you raise the issue. In a way, sometimes the last people in town want to be the last people in town. I remember I had a town hall meeting in Lebanon, Connecticut a few years ago, and a guy got up with a brogue so thick on it, you could cut it with an axe. Asked me, he says, when are we going to start shuffling all these people in the corner of the country have no right being here? I said, when did you get here? A month before, in a sense. And the strength of our country in so many ways, the strength of our, what makes us different? You could never be a Roman citizen without having been born in Rome. Japan, other countries. You could never achieve that result. What makes America so unique in many ways is we've been a welcoming country. Now, that doesn't mean you open the door.
If I could add something to that, please. You know, I live in a community where I pay very high taxes. I don't have children in the school system. I'm happy to pay taxes. I want an informed, educated citizenry. I pay my federal taxes because I believe that there should be services. And so, you know, this issue of the same thing is said about, you know, if you don't speak English, what the heck are you doing in this country? And maybe you should, you know, make some other type of arrangement. You know, we can continue to have those fights, but we're in this together. You know, what happened on Wall Street, I have nothing to do with, but it's affecting me. And unless we stop blaming each other and start working together to really resolve these issues, we're just not going to